There is a troubling issue taking shape, and it has to do with your health. When you're sick and need medication, you count on two things: that the drugs you need are available and that there's someone at your pharmacy who can fill your prescriptions. Lately, though, those haven't been guaranteed. Drug shortages have caused a number of issues, according to studies around the healthcare industry. Right now, there are 111 drugs on the FDA's drug shortage list, including chemotherapy drugs, even the ADHD medication Adderall, which has been in short supply for more than a year now. 99% of pharmacists surveyed say they're dealing with some sort of shortage. On top of that, we have the second piece of the puzzle, the pharmacy fallout, let's call it. Hundreds of pharmacists, pharmacy techs, and workers staged walkouts at Walgreens stores across the country this past week, protesting difficult working conditions and added job responsibilities, all while dealing with staffing shortages. Advocates say they're stretched too thin.
Pharmacists are not asking for more money. They're not asking for more time off. They're not asking for shorter days. They're asking for the staffing necessary to help them do their jobs safely for their patients.
CVS pharmacies staged similar walkouts last month, with pharmacists and other workers walking off the job because of staffing and other issues. So what's going on, and what should we as patients and customers expect to happen next? Well, let's get to the heart of the matter with Dr. Russ Melcher, Dean of the UMKC School of Pharmacy, former president of the American Association of Colleges of Pharmacy. Thank you for being here. Let's get right to it. First off, how did this shortage really get to where we are right now?
Well, I think, like most healthcare professions, pharmacy has been under stress, especially during the pandemic, and the expanded scope of pharmacists to being able to provide vaccinations and COVID vaccinations, and then a general shortage of staff, especially pharmacy technicians. So increased demand for pharmacists and pharmacy team services at a time when there had been a cutback on hiring of pharmacists in these large chain settings. So you had sort of the perfect storm present itself, where there just wasn't enough pharmacy staff to care for the needs that were presented to them.
So this is a two-prong issue here: the lack of people available, and then the role of these larger pharmacies, because I mean, we have CVS and Walgreens, really the big two powerhouses in our area. How much of a factor does that play of them trying to cut back? Because they've cut back too over the years.
They had cut back because demand sort of changed, and the number of pharmacists that were graduating from pharmacy programs was able to keep up with the demand prior. But right now, many pharmacists aren't going into that sector. For example, less than half of our graduates nationwide actually go into large chain community practice. People don't know that because they don't know what pharmacists do, which are a lot of different things.
Right.
Over 100 different careers that pharmacists may choose. So if one environment might get stressful, and it's not just pharmacy, it's all healthcare providers under stress. But if one environment within the pharmacy sector gets more stressful, you'll see a movement of pharmacists to other areas. But there's still a looming crisis that's coming when the number of pharmacists graduating drops substantially over the next 4 years.
What do you tell your students, and is recruitment, is enrollment an issue for you right now?
Enrollment is down nationwide, and especially in the Midwest area, but really the entire nation, enrollment is down. We graduated approximately 14,000 pharmacists as a nation last year. Within 4 years, based on current enrollment, that number of graduates of pharmacists will be less than 10,000.
Wow.
Yeah, so it's a major problem that's looming that's likely to get worse. Now, large chains are also sort of, you see some change in the overall industry, where even the big chains are changing the way that they operate. So they'll have central fill services, which may take some of that overall dispensing process out and let pharmacists do more patient care in those settings. So that's changing as well.
How do you combat that, and how do you try to grow enrollment and show these people, it's okay to be in this, and when they see these walkouts and they see these staffing issues and benefits issues, that sort of thing?
Well, I mean, first of all, it's important to understand that nearly all health professions have experienced a lot of stress, especially over the past few years with the pandemic. I think you can see that actually in the Kaiser Permanente situation now, where allied health professions, which happen to be unionized within Kaiser Permanente, are walking out for the same reasons. Not enough staff and a tremendous ever-increasing amount of work that needs to be done. So the first thing that everybody needs to understand is that we care about these issues, the well-being of pharmacists, and making sure that they have a safe and good environment to work in, and that there are so many different careers in pharmacy that our graduates can choose, and they do choose. I mean, they go to work in research, they go to work for pharmaceutical companies, they go to work for regulatory agencies like the FDA, and so many different opportunities.
What do you say to customers? Because obviously customer safety is a priority too. You don't want to have a retail pharmacist so overwhelmed that there are issues. So what's your message to customers who are saying, look, I have life-saving medications that I need filled? Yeah,
patients, that's a primary concern that we have, is access to care for our patients. You know, and greater than 90% of the population lives within 10 miles of a pharmacy. So pharmacists and pharmacy teams have been the most accessible healthcare providers. But if we start seeing pharmacies close down or shut hours, which is what we're seeing now, then patients have, problems having access to care. And so that's what we're concerned about. Can we make sure we have enough pharmacists going into the community sector, which means we need to work on the work environment for them and the workflow for them, and those are major concerns, to make sure they can practice pharmacy in a safe way so that they can care for their patients in the way that we all need to do. The other thing patients should know is that pharmacists are working hard and that they do care, and their primary interest is making sure that the patient has safe, quality care. And oftentimes, pharmacists are and pharmacy teams are the last in a series of transactions that a patient may have experienced. So for my own example, I had a kidney stone one night, kept me up all night, writhing in pain. You spend the better part of the day in the emergency department, and at the end of this series of transactions is the pharmacy, and you don't feel good. We understand that as pharmacists, but it's American Pharmacist Month. So it's a great time for patients and those that go into a pharmacy just to say, reach out to your pharmacist and your pharmacy team and say, hey, thanks for what you're doing to help provide care for us. And it's a stressful work environment. We need to support them.
All right. Well, we thank you for what you do. Dean Russ Meltzer, thank you so much for being on the program.
Thanks for the opportunity.
No problem. KMBC 9 keeping you safe with updates on issues at pharmacies across the country and here at home. We'll be watching walkouts and shortages every step of the way on air and online at KMBC.com.